Do you have fibromyalgia? Have you been told by your physician that it's all in your head, that fibromyalgia is not real? It's just you, it's all in your head. You're going crazy, right? Have you been told that? And then after they tell you that, they give you some antidepressants. Oh, this will help fibromyalgia. Have you been through that and you're still here? You're still having all of the pain, all the sensitivity, the pressure points. What is fibromyalgia? Is it even treatable? Conventional medicine says it's not treatable. And is it reversible? Conventional medicine will tell you it is not reversible just because no one's ever done it. Well, at least not according to their medications. But today I'm going to share with you fibromyalgia, whether it is, we consider fibromyalgia as just a label that conventional medicine likes to put you in a little box. Okay. So, what we focus on in our clinic is about identifying which organs are dysfunctioning and creating those, whether it's hypersensitivity, those pressure points, right? Or the overall body pain, fatigue, brain fog, right? When you find out the organ that is creating those problems and you help restore the function of that organ, guess what? Those symptoms, those fibromyalgia symptoms, suddenly, poof, magically go away. Now, does this happen for everybody? No, it doesn't, because everybody's body is different. I'm going to share with you today the typical conventional treatments, how Western medicine, how conventional medicine, allopathic medicine views fibromyalgia, and what is their treatment course today. What would your physician do when you go into their office and tell them, hey, I think I have fibromyalgia, right? Or what if they diagnose you with fibromyalgia? A lot of times when people are diagnosed with fibromyalgia, it's because the physician has no idea what is going on. The honest physicians will tell you that. They will tell you, hey, all your blood work, all your imaging, your spine, your x-rays, your CTs, they look great. All your blood work looks perfect. I have no idea why you are experiencing all of these pain, fatigue, brain fog, right? It's probably, I'm just going to put you in this box of, I don't know, also called fibromyalgia, right? So honest physicians will tell you that, okay? But today, I'm going to share with you all of those, how they view it, how they would communicate to you, what medications they would give you. And then I'm going to share with you the 5 top herbs that we use in our clinic to help people who come in with fibromyalgia leave without fibromyalgia. Okay. Not all of them are able to do that. Some of them, we just help them manage, reduce their fibromyalgia symptoms so that they can have a better quality of life. We just keep it minimal. Okay. So some patients, we're able to help them just minimize the pain sensitivity of the fibromyalgia. Other patients, we're able to help their body reverse the fibromyalgia by themselves. Now, you want to pay attention to what I just said. I didn't say we do it. My team does not do it. My team does not do any healing. Okay. We don't do healing. Natural medicine, restorative longevity medicine, traditional Chinese medicine doesn't heal anybody. What does it do then? It helps the person's body heal itself. So we don't cure fibromyalgia. Only your body can cure it. Only your body can reverse it. But you need some help maybe in identifying what does your body need, right? So that's what I'm going to tackle today. So let's dive right in. Now, before we continue, I got to give you the disclaimer. Otherwise, YouTube or Google will shut my channel down. Okay. I am not a physician. I was not trained to prescribe medications. I was not trained to do surgery. I was not trained in acute medicine, emergency medicine. Don't come to our clinic for any acute emergency conditions. Go to a hospital. That's where Western medicine is excellent in. What I was trained in, I'm a licensed acupuncturist, herbalist, and nutritionist. I was trained in traditional Chinese medicine and created restorative longevity medicine. And I was trained to help people, help provide people get the right resources so that their bodies, their organs can regain the healing abilities and eliminate fibromyalgia by themselves. That's what I was trained in. And if that's something you're interested in, then you definitely want to continue watching. All right. So let's dive in. How does conventional medicine define fibromyalgia? This is how they define it. Okay. They see fibromyalgia as a chronic pain processing disorder with central sensitization, which means the nervous system amplifies, it makes your pain worse, exacerbates it, right? More easily than normal. Okay. So, like a gentle touch in the wrong pressure point, and you're like, you're freaking out, right? That's how conventional medicine sees fibromyalgia. Common models also include impaired descending pain inhibition and altered serotonin, norepinephrine, dopamine, glutamate, and substance P signaling. So they weren't lying to you when they said the problem is all in your head, okay? I think they could have communicated a different way instead of making you think, well, when someone says, man, it's just all in your head. When you hear that, you tend to think, oh, are you saying that I'm crazy? But in reality, they're not saying you're crazy. They're saying the problem, the root cause, may be stemming from your head, which is your brain. Because what are these? These are neurotransmitters in your brain. So you see, they were actually telling you the truth. They just communicate it in a terrible way. Okay. So what's the root cause? According to conventional medicine, what is the root cause? According to Western medicine, they have no idea. Okay. No single universally proven root cause. What does that mean? No single universally proven root cause. That means there are many root causes. However, there's not one root cause that every scientist, physician agrees upon. Every medical association agrees upon. Okay, that's what that means. The main conventional model is abnormal central pain processing rather than ongoing tissue damage. And with contributions with stress system dysregulation, sleep disturbance, autonomic imbalance, and altered neurotransmitter signaling. Okay, so yes, neurotransmitters are in your brain and there's a short circuit. So that's why your body's becoming hypersensitive to certain pressure points. According to conventional medicine, do treatments cure fibromyalgia? What do you think is the answer? If they can't even agree upon this disorder, this label that they created, why would they have a solution? They can't, right? So obviously, there is no standard medication is considered a cure or permanent fix. So in Western medicine, there is no cure, there's no permanent fix to fibromyalgia. The main goal is only symptom reduction, lowering your pain amplification, improving your sleep, reducing fatigue, and helping function. Okay? So it is just putting a band-aid. So the treatments for fibromyalgia, according to Western medicine, you put a band-aid. Once it gets all soggy, you put another band-aid, okay? But you never fix the problem. Now, their solution, obviously, Western medicine solution is always drugs first. Drugs is the first line of defense, first line of treatments, right? And so if their treatment is medication, the next question you should ask is, how long should I take these? Well, you might have already know the answer because if number one, they don't know what's causing your fibromyalgia and there's nothing that can fix it, then guess what? How long do you think you're going to have to take their medication? Yes, for the rest of your life. Okay. If medication clearly helps, people often stay on it for a few months, and many clinicians reassess around in 6 months. It is not usually meant to be a lifelong by default if it does not clearly help. Yes, but many fibromyalgia patients, by default, that we see in our clinic, and we've seen thousands of fibromyalgia patients, when they come to our clinic, they've been taking these meds for years. Okay. It should usually be stopped. It should be stopped. Why would you be taking antidepressants, anti-anxiety medications when you're not anxious, you're not depressed, and you're using it to treat fibromyalgia, right? So you weren't depressed, you weren't anxious, and now you're taking these medications, antidepressants, which their side effect is anxiety and depression. So you took one medication to help your fibro. It kind of helps. It never helps at 100%, but it created another problem. Now you truly feel like you're going crazy. Okay. So again, the physicians were telling you the truth in the beginning. They say it's all in your head, right? And if you take the medications, originally they said it's all in your head, but they really meant it's the neurotransmitters in your head. But then if you take their treatments, then it will really be all in your head. What you thought it was, you going crazy because you're going to be, you weren't an anxious person and suddenly now you're so anxious. You weren't a depressed person, but now you taking this medications, you suddenly become depressed. You will feel like you're going crazy. This is not my opinion. These are the expressions. These are what our patients have told us. Okay. I'm only expressing what our patients have verbally told us about their personal experience. Long-term side effects. So duloxetine and similar drugs can cause nausea, dry mouth, constipation, sweating, insomnia, sleepiness, sorry, and fatigue. So if you didn't have sleeping problems, taking these medications, many of the fibromyalgia patients now have insomnia. Pregabalin commonly causes dizziness, somnolence, headache, weight gain, and in some patients, tolerability is a major reason people stop treatment. Yes, it's like people who were never taking medications suddenly develop fibromyalgia and they start taking these medications, and that created all of these other problems. Okay. So, what is the gold standard for fibromyalgia medications? Right. The first one is duloxetine. It's often used when fibromyalgia includes severe pain, low mood, or fatigue. Why? Because what does it do? It raises serotonin and norepinephrine signaling in descending pain control pathways, which can reduce central pain amplification. So it kind of numbs you down, this medication. It numbs the pain because if you're desensitized, you become numb, right? Next medication. These are gold standards. If you went to your physician, they will just go through these 4 main categories and give you one by one and test it out. Milnacipran. Yes, I'm probably mispronouncing and butchering these names. I apologize. I didn't go to Chinese medical school to learn how to pronounce medications properly, so I apologize. This is used widespread for pain and fatigue, especially when the goal is stronger norepinephrine support. It increases serotonin and norepinephrine signaling, especially norepinephrine, which may improve pain inhibition, energy, and function. Okay. So this is going to numb you even more than the first one, right? Because its goal is so that you don't feel pain. But here's the thing, pain is your friend. So if you're on these medications, you got to be careful. If you're exercising, right? Make sure if you're doing HIIT training, lifting weights, you want to make sure that you don't overdo it because you won't feel it. You could be tearing tissue and not even feeling it. Okay. Although most people who have fibromyalgia are not lifting weights, which they should be. Next medication, pregabalin, often chosen when sleep disturbance and nerve-like pain are prominent. Okay, it reduces excess release of excitatory neurotransmitters, help calm your hyperexcitability pain circuits, and often improves sleep. Okay, so it calms down the excitatory neurotransmitters. So if you take this, now I didn't list all the side effects to here, right? Just think about it. It reduces excess excitatory neurotransmitters. You need excitatory neurotransmitters, okay, in order to be motivated. So if you take this medication, you might have the side effect that you suddenly feel, man, I just don't feel like doing anything. I'm just not motivated, right? I'm just going to sit on the couch, watch some TV, or scroll on social media, right? And then a month later, you're like, man, where did these 20 pounds come from? Again, side effects. Amitriptyline, often used as low dose for pain, poor sleep, and fatigue. It increases serotonin and norepinephrine signaling, again, numbing you down, and has a sedating effect. It may knock you out. These drugs are powerful. They may knock you out. You may be able to physically sleep 8 hours, but these medications do not increase your quality of sleep, your deep sleep. Okay. Why? Because you'll wake up tired. You just slept 12 hours, but you wake up tired. Okay. Again, this is not my opinion. This is what our patients have told us because I've never taken any of these medications. So I have no idea how they will make your body physically feel. Okay. So neurotransmitters, we talked about Neurotransmitters is what Western medicine believes is the main cause. So let's understand, because we saw up top, right? A lot of the medications were increasing serotonin and norepinephrine. What do these neurotransmitters do? Okay. So serotonin, it helps pain regulation and it helps regulate pain inhibition, which means stop pain, stop you from feeling pain. Okay. It helps improve your mood, your sleep, your appetite, and gut function. Fibromyalgia research often links lower serotonin activity to weaker descending pain control. Norepinephrine. This is the other neurotransmitter that the medications are trying to increase, right? They controls alertness, attention, stress readiness, blood pressure, and pain modulating pathways. Reduced norepinephrine support may weaken the body's natural pain dampening system. So serotonin and norepinephrine, like I've said before, it numbs your pain, it numbs you. It makes you not feel the pain as much. Dopamine helps regulate motivation. Okay. You need dopamine. Okay. Opposite of serotonin, you need motivation, right? Reward movement and mental drive. Dopamine dysregulation has been linked to pain processing and fatigue and fibromyalgia. And then epinephrine, which is also called adrenaline, it drives the acute responses such as higher heart rate, blood pressure, blood sugar availability, and it may reflect autonomic dysregulation. Okay. These are your neurotransmitters that these medications above were trying to manipulate. Okay. So, with what do we do in our clinic? You're like, hey, Jimmy, okay, I want a natural approach. Or maybe you don't care if it's a natural approach. Maybe you want to fix the root problem. Okay. So there's many root causes according to Chinese medicine. And I will actually do another video on how Chinese medicine views fibromyalgia. Okay. But I wanted to go over some of the solutions that we have executed for the past, oh wow, 19, coming up 20 years. Over the past 19 years, we've executed these successfully for fibromyalgia patients. These are not the only 5 herbs we use. If you've watched my other videos, then you know in our clinic, we do something different from almost all other acupuncture clinics. Is we never prescribe one herb by itself. We always combine 30 to 40 herbs together because by that combination, that makes it safe. That's my secret recipe. I found a way how to make Chinese herbs. Some of them do have side effects, but I found a way to neutralize that side effect. I found a way to neutralize the side effects of these Chinese herbs so that you only get the benefit, right? How cool is that? Only my clinic and my team have my secret formulas, okay? But we're going to be releasing them on Restorative Longevity, my new company. All right, first one is Angelica pubescens. It's also Chinese, it's called Du Huo. It's often considered when symptoms are aching, when your fibromyalgia is aching, heaviness, stiffness, and pain that feels worse with cold or damp weather. Like, do you ever feel a lot of fibro patients, before it rains, they're like the osteoarthritis patients. They can tell me when it's going to rain. They are a better and more accurate weather person, weather predictor than the weather person on TV. How it may help. It's this herb, Angelica pubescens, Du Huo, is anti-inflammatory. Analgesic action may help reduce musculoskeletal pain signaling. Okay, people with prominent body aches, this is best fit. Stiffness, weather sensitive pain, right? And I've all of this dashboard, okay? If you want this dashboard, just comment fibro in the comments and I will have my team send you a link to access this dashboard, okay? All of this information from this dashboard is the facts on this dashboard are not my opinion. They all have a link to the clinical study research. If it's my opinion, I've been saying, this is my opinion, or I've been saying, hey, this is from our patients, or this is from our experience in our clinic, okay? So duho we commonly use. This is especially for lower body, from the lower back, all the joints below. Okay. So any sensitivity in your lower back and lower, this is a number one top single herb you have to have in your formula, right? But let's say you have pain everywhere. Your fibro pain is everywhere. Then we come to Corydalis, my favorite pain relieving herb, Hu Suo. It's often discussed as a broad analgesic potential in people with widespread pain and sensitivity. It may modulate dopaminergic and pain pathways, so dopamine pathways, right? Analgesic effects. It's best fit for main symptoms for diffuse pain and strong pain sensitivity. Okay, so super, it can help. Now, what's the difference? Let me, before I continue on, maybe you're asking, okay, these do similar things than the medications above. What's the difference, Jimmy? Right? These are not doing it for you only. They can help you modulate your pain pathways. They are like pain analgesic, like the pain medications. They can do that. But more importantly, they are providing nutrients for your internal organs to modulate, to control your pain by yourself. How cool is that? All right, next one. Ziphus, Suan Zao Ren. This is a common herb used for insomnia, right? Irritability, persistent fatigue are central features. It's best fit for people who have insomnia, restless sleep, next day exhaustion, especially if you're taking the medications above, okay? You can take these herbs. Now, let me rephrase that. We have given these herbs to our patients who are taking all of the medications above, and we have seen drug and herb interaction. What is the interaction that we see? The herbs help the drugs work better. The herbs help neutralize the side effects of the drugs above. Okay, that's what we have seen in our patients. Now, I'm not telling you to go do that. All of my videos are educational purpose only. I'm only sharing what we've done for our patients. You either need to come to our clinic or you need to find a local acupuncturist to help you. So Suan Zao Ren, what does it do from a pharmacological effect? It's a sedative, anxiolytic effect, helps you with your anxiety. It can help you calm you, support your sleep quality, which is a major symptom driver and fibromyalgia, right? Next, astragalus, Huang Qi. Most people may know this for fatigue, poor resilience, low recovery capacity for major complaints. It's best for people who are exhausted, symptom worsening after exertion, which fibro people tend to have, right? That's why I said earlier, fibro people actually need to get into the gym, but most fibro people are not in the gym. Okay, I'm not saying throwing heavy weights. I'm talking about just light weights, resistance. So how does astragalus help fibro? Well, its immunomodulatory anti-inflammatory actions may support energy and recovery rather than directly targeting pain alone. Again, if you want your body to fix your fibro, you need to figure out which organs in your body are not functioning at optimal levels, and then feed your body with the right nutrition, like astragalus, right? Like Huang Qi, Suan Zao Ren, Hu Suo, feed it the right nutrients so that your organs can heal and start doing the function that they were built to do, which is to regulate your pain signals so that you don't have this fibro. Last one is cinnamon twig. It's Gui Zhi. This is also for a lot of times for body aches, muscle. This is perfect, right? There's so many. There's a combination of Gui Zhi and another Chinese herb called Ge specifically for muscle problems, and especially for calves. You know what herb that we use in our clinic? It's called mu gua. You know what it is? Papaya. See, this is the beauty of Chinese herbs. Chinese herbs are food. They're not man-made chemicals. They grew in the ground, in the soil that God made, right? That's why they're so effective. Let's see, is best fit for people with cold intolerance. This is for cinnamon twig, stiffness and achy pain, okay? It helps increase circulation, reduce pain, stiffness patterns associated with cold sensitive myofascial discomfort. Okay. And so these are the 5 top herbs. Like I said, they are not the only herbs we use. We use 30 to 40 herbs, and they're different for each fibro patient. That's another beauty of our clinic. We customize formulas specifically. One fibro patient, because here's Western medicine likes to put everybody in one box. If you have fibro, then you have all of these symptoms, right? And most likely these are all the problems in your body. And that's not the case. That's not our experience, okay? Now, are there common dysfunctions, like common organs that are dysfunctioning in most fibro patient? Absolutely, okay? Absolutely. Liver is one of them. I'm going to give you a sneak peek. Liver is one of them, but it's not for everybody. The liver doesn't dysfunction in every fibro patient that we've treated in our clinic, okay? So in order to get the best results for you, you got to customize based on your body's dysfunctions, okay? So what does that mean? That means you got to figure out which organs, your whole body was built to self-heal. You probably knew that, right? Because if you got a paper cut, do you have to do anything to make sure that to make your body heal that paper cut? No, you don't. It heals by itself because you have that innate healing. You have that innate healing system. So your organs were built to do certain functions. When it loses that function, then guess what? It creates symptoms. And fibro is just a symptom. Stay tuned if you want to know how Chinese medicine, how my clinic, how my team at Achieve Integrative Health, how we see fibro and how we see it. I've already shared with you some of the herbs that we use for our fibro patients, but how do we determine which organs? Then you got to watch the next video. All right, see you there.